Hello and welcome. In the next few minutes, I'll be discussing risk factors for osteoarthritis. Now, I've made a number of videos previously, and I would encourage you to click on the links below to listen and watch, and then possibly continue with this. Now, give me a few minutes of your time. You most likely will learn something you didn't know. Number two, be willing to subscribe and then share. I've already discussed in a previous video what osteoarthritis is and how to recognize the features. And so today, we're going to be looking at knee osteoarthritis. What are the risk factors? Number one, age. By far the most important risk factor for osteoarthritis is age. Now, as we get older, a number of changes do occur. And so the cartilage that was or serves as the shock absorber in the joint becomes less able to carry out its functions, and so the features of osteoarthritis would occur. And that's the reason why, as people get older, there's a tendency that they would at some point develop features of osteoarthritis. Unfortunately, age is not a reversible factor, and so remains the most important reason why people will develop osteoarthritis. Secondly, family history. Now, if there's a family history of osteoarthritis, the chances are that you are at risk of developing same. It's not uncommon for me to ask the patient whether somebody in the family, maternal side, paternal side, has osteoarthritis. And usually, if that's the case, there's a very strong predilection to developing osteoarthritis. Now, another very important risk factor is obesity. For people that are obese, overweight, or fall into the category of being obese, the problem is that amongst other reasons, the amount of pressure that is applied on the knees as a result of the weight becomes problematic down the line. Initially, they may or may not have symptoms, but as time progresses, they most likely will develop osteoarthritis involving the joints of the knees and possibly the joints in the hands. And so in the part one of this video, I've talked about at least 3 risk factors: age, family history, and obesity. In the next video, which is the part 2, I will mention 3 other risk factors for osteoarthritis of the knees. Thanks for listening and watching.